why do we get them? Mainly it's genetics, but it can also be caused from environmental damage, such as playing sports, standing for long periods of a time, crossing your legs, and even poor diet. Ultimately, the valves aren't actively pushing the blood through as they once did, so the blood gets stuck and it causes varicose and spider veins. Before, the only treatment option were injections. They would inject a solution into the vein, which would cause them to collapse, and over time the appearance of them would fade and eventually go away. Now, the pros were that it worked quite well on varicose veins, but they did not work on spider veins, primarily because they were too fine. They also cause bruising, they're incredibly painful, and the injection sites aren't very attractive. And most people actually complain about the possible reactions that they can get from injecting a toxic solution into the body. Now, 25 years ago, they developed a laser technology that had similar effects except with light therapy. A laser is placed over the skin, a pulse of light is entered into the vein, which would cause the trapped blood to drain out, and that's it. Over the next 6 to 10 weeks, you can see the appearance of it fade and eventually disappear. It's virtually painless and it's actually quite effective, and it's really the only treatment option for fine spider veins, plus it's more of a natural treatment option with less downtime. Now, the laser itself actually works in 3 weeks. It works like a traffic officer. It clears up traffic jam by clearing away cars. It redirects the flow to nearby streets, and since the road is now permanently closed, cars can no longer get stuck in traffic anymore. Now, some of the most commonly asked questions that I receive are, if we get rid of the vein, what happens then? By redirecting the flow, we can actually prevent the condition from worsening. Another question is, where does the blood now go? It'll simply redirect to healthier veins. And one of the most common questions is, will it affect my circulation? It will actually help your circulation because everything is flowing with ease, releasing pressure. Now, the number of treatments depend on how large the vein is and, of course, your overall health. But on average, we do suggest approximately 3 sessions at 4 to 10 week intervals. However, home care is key to getting the most out of your treatments. But it's a commonly done procedure, and it's actually been around for a long time, so it's low risk and inexpensive. It's actually one of my favorite treatments to do because you can see the varicose and spider veins fade right before your eyes.